Assalamualaikum and greeting to everybody. My name is Muhammad Helmi Husaini bin Azhar from course BMHS OUM Melaka. Today, I am going to present about pre-hospital care and ambulance service, MBCP 2424. And I choose a topic about the management of a pre-hospital care patient with closed rib fracture. The content is introduction of the case, definition, etiology, pathophysiology, symptom of the case, causes of the case, risk factor, demographic data of the patient in MECC hospital, investigation, management and treatment of the case, prognosis, complication, prevention, health education, and conclusion. Introduction of the case. The rib have 12 pair and form rib cage. The structure like a cage that protect the heart and the lung. In additional of protect the two organ, the ribs are also supportive to various type of muscle, especially at the top of the body. Because this can cause disruption daily activities, given that the location of the ribs is required complicated and close to the important organ. This frustration will usually be left to heal on its body. Definition. Broken ribs are common injury that occur when one of the ribs break or crack. The most common cause is the chest trauma caused by fall, vehicle accident, or current effect involved in sport. Etiology. It's known that the rib bone fracture in normal healthy adult can be caused due to the high energy trauma. For example, MVA is motor vehicle accident. Sport related injuries, fall from height, but it should be noted that the most important risk factor for insufficiency fracture is chronic metabolic disease such as osteoporosis, osteopenia, eating disorder behavior, high age, prolonged corticosteroid usage, female gender, lower BMI, history of a recent fall, and period fracture. Closed rib fracture is the pattern of bone fracture and severity of injury depend on various of factor. Patient past medical history, especially any bone disease affecting the equality of bone, such as osteoporosis, malignancies. Second, energy of trauma. Third, bone quality. Below mentioned processes cause decreased bone mass density. Number 1. As osteocytes grow, viability of cell decrease, thereby decreasing the bone mass density. Number 2. Autophagy is the mechanism through which osteocytes evade oxidative stress. Number 3. The capability of autophagy in cell decrease as they age, a major factor of aging. The pathophysiology of the case, where the part concerned has lost its cartilage relationship to the rib frame, cause the occurrence of paradoxic movement. Breathing create thereby decreasing the bone mass density. The segment flay goes into when aspiration reduce the amount of air that should be put into the lungs. Next, during expiration of phlegm, segment move out and effect while patient exhale. Mediastinum to an injured place. This condition causes ventilation in alveoli to diminish, secretion detaching, and resulted in atherosclerosis, hypoventilation, hypoxia, and cause respiratory acidosis. Symptoms of this case, typical broken ribs symptoms are pain over the affected site, which increase when breathing in and out deeply, cough, sneezing, and when moving. Pressing on the broken rib are also heard. You may also hear the sound like cracking and feel an accumulation of air. Is skin emphysema. In some cases, you may feel the broken ribs from the outside has a stab in the skin. This appears to a closed fracture in unopened broken ribs, a fragment of the bone from the skin. Causes. Broken ribs are also commonly caused by direct impact, such as those from motor vehicle accident (MVA), fall, child abuse, or contact sport. For example, when someone sleeps in the bedroom and bang their rib against the sink or the edge of the bathtub. A fall in the stairwell is also often the cause of broken ribs. Ribs also can be fractured by repetitive trauma from sport like golf and roaming off from severe and prolonged cough. How about rib fracture? Particularly in the case of ribs serious fracture, air or blood can get into the space between the pleura and the lung. It's called pleural space. A pneumothorax is called abnormal accumulation of air in the rib cage, or hemothorax is accumulation of blood in the thoracic cavity develop. Osteoporosis, having this disease in which your bone lost their density, make you more susceptible to a bone fracture. Sport participation, playing contact sport such as hockey or football, increases your risk of trauma to the chest. Lesion in a rib, a cancerous lesion can weaken the bone, making it more susceptible to break. If air collects the mediastinum, the result is a so-called pneumomediastinum. In the case of a serious rib fracture, breathing may be restricted not only because of the pain, but also because of the unstable chest wall. In an accident, in addition to a broken rib, it's called rib fracture, the lung can be bluish or injured. If the first or second ribs is broken in an accident, large vessels can be injured, such as the subclavicular artery and vein and the aorta. This is demographic data Patient name, Lieutenant Colonel Bersara Unggah Anak Angki. Register number 6068/21. Age 65 years old. Weight 65.7 kg. Height 171 cm. Gender male. Race IBAN. Religion Christian. Address Lot 996 Jalan Merbok 1/10 Taman Bukit Kayu Hitam, Masjid Tanah Melaka. Occupational Pesara Tentera Camp 21 Squadron Commando. In MECC Hospital 94 Hospital Angkatan Tentera. Called by witness, there was MVA motor vehicle accident, car with bicycle around 10:00 hours at Masjid Tanah near the traffic light. It's called accident zone. The number of patient is 1. The driver was in good condition, but the cyclist is worse condition. Patient still alert and bleeding. This report is based on witness statement over the phone. Then the call was cut off. The distance of the location take around 10 minutes, and the MECC instructed the team EMS to go to accident zone immediately. Chief complaint. Patient 65 years old, complaint of shortness of breath and severe pain over left chest. Patient unable to walk. Glasgow Coma Scale is 13/15. The case clerking for medical history patient, no case of diabetes, hypertension and on medication. For surgical history, patient is nil and patient was allergic to dust. For social history, patient was social smoker 20 cigarettes per day, alcohol or non-abuse. Sign and symptom patient are shortness of breath, chest pain with severe on the one side, and bluish discoloration of the skin and lips. This symptom present during patient in the ambulance. Physical examination or primary survey. Physical examination or primary survey and assessment by DRA-BCDE for the investigation of this patient to determine its state of health, protect the airway and the cervical spine, and remove all foreign body. Use C-spine to immobilize. Always observe the neurological during inspection. Detect of reduced chest rise at left. Palpation, the chest spring positive. Percussion, resonance sound. Auscultation, reduce A and 3 are equal. After that, routine examination are monitor vital sign every 5 minutes. Abdominal pain, patient was soft. No tenderness, laceration scar, no wound. Pelvic spring was negative. No wound and no deformity. 2 cm laceration wound over right hand, and patient able to move both hands. Obturation wound over left knee. No long bone injured, and patient able to move both legs. No step deformity. No bluish. No hematoma at posterior body. Patient has be blanket to avoid hypothermia. different diagnosis. By the way, statement of E&E department telling the different diagnosis to this patient are: first, pneumothorax; second, tension pneumothorax; third, spontaneous pneumothorax; fourth, closed rib fracture at the left side. The investigation is vital sign. Based on investigation at the accident zone, such as vital sign: temperature 37.0 darjah Celsius, pulse rate 101 per minute, respiratory rate 24 per minute, blood pressure 166/99 mercury, SpO2 24 in room air, pain score is 8. General primary survey, Glasgow Coma scale, total 13/15. Is spontaneous, eyes opening is 4, orientated is 4, obey to command is 5. Systematic examination, secondary survey, mental status, conscious, central nervous system, pupil react to normal size, ear, nose and throat, ENT has no bleeding, nerve is normal, cardiovascular system is dual rhythm, no murmur, lung or respiratory system is detect resonant sound, A and 3 are equal. Are also fast scan sonographic for trauma, abdomen, no tender, laceration wound, and soft. Info case at MECC Hospital, 94 Hospital Angkatan Tentera. Collect by leader team or MA at accident zone. The number of patient is 1. Patient 65 years old, shortness of breath and severe pain over left chest. Patient unable to walk, Glasgow Coma scale is 13/15. Are also given vital signs such as temperature, pulse rate, respiratory rate, blood pressure, SpO2 94 room air. Are also given face mask 5 liter per minute. Insert 2 large bore IV with 1 pint normal saline drip. Are also ready to move at A&E 94 Hospital Angkatan Tentera. The investigation are taken such as full blood count, white blood cell, liver function test, total bilirubin, renal profile, creatinine, lipid profile, chest radiography, chest x-ray, closed rib fracture at the left, 7 until 9, lung normal shape, artery, blood gases are taken, no ability detect, urinary catheter insert, have no hematuria, clean urine 100 cc. The diagnosis is regarding statement from the A&E department. Doctor diagnosed by sign and symptom, physical examination and clinical laboratory investigation, chest x-ray. The patient was diagnosed closed rib fracture at the left, 7 until 9. The management of pre-hospital care and treatment is called primary survey. Firstly, assess AVPU is alert, verbal, pain, unconscious, and physical examination assessment by DRABCDE for the investigation of this patient to determine state of health, maintain the airway and circulation is the immediately assessment and stabilization the patient trauma. 5 liter oxygen with face mask, insert 2 large bore IV with 1 pint normal saline drip. The management and treatment at A&E department. The medication that had given to this patient are IMATT 0.5 universal unit, prevent tetanus infection, analgesic IV fentanyl for reduced pain. The complication of the closed rib fracture is torn or punctured aorta, a sharp end of a break in one of the first 3 ribs at the top of your rib cage, cause ruptured your aorta or another major blood vessel. Punctured lung, the jagged end of a broken medial rib can puncture a lung and cause it to collapse. Lacerated spleen, liver or kidney. The bottom 2 ribs rarely fracture because they have more flexibility than do the upper and middle ribs, which are to the breastbone. But if you break a lower rib, the broken end can cause serious damage to your spleen, liver or kidney. How to prevent the closed rib fracture is protect yourself from athletic injuries, wear protective equipment when playing contact sport, reduce the risk of household fall, remove cutter from your floor and clean split properly, use a rubber mat in the shower, keep your home well lit and put sky roof baking on carpet and area rug, strengthen your bone, getting enough calcium and vitamin D in your diet is important for maintaining strong bone. Aim for about 1200 mg of calcium and 600 international unit of vitamin D daily from food and supplement. The health education is physiotherapy for a patient with multiple fracture ribs is to minimize any compromise of the respiratory system. An initial assessment is carried out to obtain a set of baseline objective markers from which to develop a treatment program that include respiratory rate, oxygen saturation, breathing pattern, peak oximetry flow rate, ABG artery blood gases, and auscultation, listening to chest sound. Treatment is carried out at a minimum of twice a day for the first 3 days and thereon, and as if required, best at least session the patient is relaxation and the initial objective marker retested. Conclusion: rib fracture vary from being a minor injury that can be treated in outpatient to a major injury that can have life-threatening consequences. Accurate diagnosis, adequate anesthesia, and effective physiotherapy are all essential components in the management of the rib fracture if complications are to be avoided.